I want to congratulate my staff and the many community organizations, some of which are here, who have worked together so hard in a very competitive field to put together two blockbuster applications. And not only are we one in 44 communities that are getting this around the nation out of the 400 applications, there are only 7 communities nationwide that have gotten both the tobacco control and the obesity control proposals funded. So once again, my hat's off to the wonderful staff under Paul Simon, many community partners. You did a great job. So what that means is really we can look forward to a healthier tomorrow for everyone in Los Angeles County. Heart disease, diabetes, cancer, and other chronic diseases account for over 80% of the premature death and disability in this country and in this county. And chronic disease estimated to cost about 75% of the total cost of health care, which impacts every individual, every family, every work site, every insurance company. Well, we know that access to health care, as Supervisor Ridley Thomas reminds us, is critically important for treating disease and relieving suffering. We all hope that there will be 32 million more people covered at the end of this weekend than there is now. But it's also important to remember that most of what determines whether someone is healthy is not found in the hospital or in the doctor's office, but found in the environments in which we live, our homes, our communities, our restaurants, our schools, where we work, how we recreate. And we have to, if we want to make progress in these chronic diseases, we have to address directly these environments. It's precisely for this reason that the funding that we're receiving represents a vital opportunity to truly improve the health and quality of life of our residents, the environment in which all of us live. The $32 million that we are now receiving will fund 2 distinct projects over the next 2 years. There's $16 million for Project Trust, which focuses on tobacco control and prevention, and the other $16 million is for Project Renew, which will focus on obesity, physical activity, and nutrition. And these 2 focus areas were chosen specifically because they represent the leading preventable causes of death nationwide, in California, in Los Angeles County, and broadly within our wonderful county. Roughly 1/3 of all deaths are caused by smoking, lack of physical activity, and poor nutrition. And as Supervisor Yaroslavsky reminded us, we have more than 1 million smokers still in Los Angeles County, and many more who are exposed to secondhand smoke every day. Smoking rates are particularly high among African Americans, those living in poverty, those suffering from mental illness and substance abuse problems, and also among Asian males. The obesity epidemic in this country continues to rage. Among adults, obesity has increased from 14% of the adult population in 1997 to 22% in 2007. If you take those with overweight and obesity together, it is the majority of adults in Los Angeles County and 1/4 of all children. That's nearly 4 times higher than it was a generation ago. Even among 3- and 4-year-olds, obesity rates are climbing. So what is the future for these children? The Center for Disease Control and Prevention has projected that if we don't take action to reverse this obesity epidemic, 1 in 3 children born today will develop type 2 diabetes, 1 in 3. And among African American and Latino children, 1 in 2 will develop diabetes in their lifetime. So there is real urgency and there is real import in what we're talking about. So I think we can all agree that the stakes are very high. We're committed over the next 2 years and beyond that to work with many community partners as we create environments where the healthy choice becomes the easy choice, where all county residents have easy access to affordable, healthy food and space for physical activity, and where tobacco use is not socially acceptable. So now the real work begins. Most of this money is going out to our wonderful partners. We have a tall task, but you know what? We can do it. And again, my thanks to everybody who has participated in this. Now, as everybody says, the real work begins.